Hi, Dr. Frega here with Ideal Health and Wellness, and this week I am 33 weeks pregnant. So as I'm getting closer to my due date, lots kind of going on in terms of, thinking about prepping for the baby, maybe some nesting. I definitely am kind of getting anxious more around the house in terms of like trying to get stuff ready. But kind of the next couple segments here, I thought we'd talk about just preparing for birth, so talking about birth plans. Today we're going to talk about pain management during labor, because it is something to start thinking about. So obviously we have our traditional pain management techniques with epidurals. They can do IV pain meds. Some hospitals are even bringing back nitrous oxide. And I would encourage you to talk to your providers about those options, the risks and benefits. Now, with my first one, I did a non-medicated birth. And that's our plan with this one as well too. So today I'm going to talk about just different ways we can deal with that naturally during birth. So I took Bradley, which was a great class to take because it's partner assisted. So it really kind of gets your partner involved. And then, talks about different ways that they can help with pain management during birth. So the first way, again, we're talking about pain management is more physical. So there are a couple different techniques that you can use. Again, doing different positions. And again, that's just going to depend on, during labor, what feels good to you. So some women really benefit from bouncing on the ball. Some women like to get in the shower or the tub. Again, others like massage. Typically, I love getting massage, and that's a great relaxation pain management tool for me. But when I was in labor with my first, I did not want to get massaged at all, which was interesting to both me and my husband. But there are some specific things that you can be doing to help your partner through this. Specifically in the low back region tends to give a lot of relief. So I'm going to just have my skeleton here so you know about the region that I'm talking about. So sacrum's here. Coccyx down here, and then again, this is what people refer to typically as their hip bones. So some good techniques to do is putting pressure over the sacrum. So again, your partner can make a fist and just put a little bit of pressure through there. And again, this is going to be what feels good to mom while she's in labor, and not all the things that I say are going to feel good to every person, but some can really help. Another one is, again, putting a little bit of pressure on the coccyx as well too. And again, you can use a flat palm or just kind of use a fist to kind of push down. And again, mom will tell you what kind of pressure she wants during this as well. Another one would be hip squeeze. So again, sometimes just kind of putting your hands on either side of the hips and applying pressure feels good to them. There's great techniques on the Spinning Babies website where you can use a scarf under the pelvis, and I would definitely recommend going to that website because they have some videos and pictures that show you what to do, but that can take a lot of pressure off during labor for mom as well. Bringing 2 tennis balls, and they say use pantyhose. I use a big tube sock, so you can put the 2 tennis balls in there, tie off one of the end, and you can roll that up and down the spine and up and down the sacrum as well too, which can feel really good for mom. Sometimes doing like a heat or ice pack in certain areas is also beneficial. There are some great acupuncture points to do, and you could do acupressure points as well. So Deborah Betts is a well-known acupuncturist in Australia, and she's got a website that will actually show you certain points during labor that can be really beneficial for pain management. So I would definitely recommend checking that out. Another point to pain management and relaxation would be the mental component of that. So, just preparing yourself and again, going through your options and what you want out of your birth. Again, some people say, going into it, I want the epidural. And again, just making sure that you're educated and knowing at what point, to get the epidural, and also being prepared because you're not going to be able to walk into the hospital and get the epidural right away in most cases. So you are going to have to go through some of labor. So just being prepared for that. Again, for me, I did not want to do pain management. So just mentally preparing myself for what was going to happen. And for me, that was educating myself on just the different phases of birth, what transition looked like, what each phase was going to look like. And again, Bradley was really helpful for that. The other important factor is going to be emotional support. And this is where partners can come in and play a huge role. So, I say, every time we talk about the birth of my daughter, I always say that my husband's support and just kind of knowing what to do and being there was better than any drug I could have ever received. Not once, even though the pain was intense, did I feel like, hey, I want to get an epidural or pain meds. That never crossed my mind. But my husband kind of knowing, what to do, and encouraging me and just kind of guiding me through the whole process was really important. So again, that emotional support is key. So again, those are just some ways just to start preparing yourself, and again, educating yourself, kind of making a plan of what you want, and again, how you want your labor to go, and having a plan B and plan C is also helpful as well too. So my thing was always, I would love to do a non-medicated birth, but I had never been in labor, with my first one. So having a plan B and C was also important to me as well. Luckily for us, we were able to stick with our plan A. So next time we're going to talk about birth plans. I will share my birth plan, and just kind of things to think about, maybe get more information, maybe hopefully things that maybe you haven't thought about that will kind of spark your interest and maybe be something that would be important to you. So that'll be what we talk about next week.